Hi friends, I am Dr. Vineet Garg, DM cardiologist from Agra, practicing as interventional cardiologist in Blossom Hospital, Agra. Today we will discuss about the latest update in the management of the hypertension. If you look at the data from the WHO, nearly 63% of the total deaths in India are due to non-communicable disease. Non-communicable disease are such as diabetes, blood pressure, cardiovascular diseases, and so on, out of which 27% are attributed due to only cardiovascular disease, which include stroke in the form of cerebral infarct or cerebral hemorrhage, and coronary artery disease in the form of angina and myocardial infarction. Raised blood pressure is among the most important risk factor for CV diseases. However, we all know that it remains poorly controlled because of the lack of awareness, especially in the Indian population, especially in the rural population of India. If we look at the Indian data, around 30% patients of Indian population are suffering from the problem with high blood pressure, but 50% patient of hypertension only aware of their problem, out of which only 50% is taking the treatment for this blood pressure problem. So in India, it remains so much in a high quantity that you can assume that 30% means around 50 crores people of Indian population are suffering from hypertension, out of which only 50% patients are taking treatment, and out of which 50% are in controlled range. If we look at the International Society of the Hypertension guidelines 2020, they said that the inclusion of the optimal and essential treatment paradigm attempts to address the issue that in resources poor setting. According to American College of Cardiology guidelines, which released a statement in 2021 that in stage 1 hypertension means the hypertension patients which in the range of systolic blood pressure of 130 to 139, while the diastolic blood pressure is from 80 to 89, but without any risk factor, do not require a blood pressure treatment. What they require only the lifestyle modification in the form of low salt diet, high diet with high fruit and the vegetables, less dairy products, less fatty products. But after 3 to 6 months of these lifestyle modification, if patient is still in the stage 1 hypertension, you have to start the treatment with the pharmacological treatment. This is according to the ACC/AHA guideline 2021. As we all know that the world is suffering from a pandemic with the name of COVID-19, and COVID-19 causes ARDS, that is acute respiratory distress syndrome. It is a fatal complication of COVID-19 infection in which there is a lung damage, and lung damage to such an extent in which the patient is not able to maintain their saturation. Now, in patients with COVID with ARDS, a recent study published in Journal of the American College of Cardiology reports that metoprolol can reduces the lung inflammation and improve the respiratory function, especially in the patient who suffered from COVID-19 induced ARDS. Now, if we look at the SPRINT trial, which tells that lower the blood pressure by any drug, better is the CV risk. But if we look at the other trials or other study in which they tell that if we reduces our target of systolic blood pressure from 130 to 110, this range, that is 110 to 130 range patients target, reduces CV adverse event tremendously versus placebo. And the SPRINT trial also said that lower the blood pressure, higher is the reduction in the risk of the CV event in future. You use any drug, but your aim is to reduce the blood pressure up to 110, 120. Now, the Europeans guideline also emphasize the importance at the level of the blood pressure, that is up to 110, 120. But one new concept in the management of the hypertension nowadays is 24-hour BP coverage. Means you have to use a drug which not only is a very efficient drug, but also a long-acting one, so that it can give a 24-hour BP coverage. Means we have to choose a antihypertensive drug which has high half-life. And if we look at the high half-life drugs, that such as telmisartan, amlodipine, metoprolol, then these are the drugs which gives 24-hour BP coverage because they have high half-life, that is 24 hour, around 20 to 24-hour half-life. So in only a simple OD dose, it can act up to 24 hours. Now, in the role of ambulatory blood pressure monitoring, according to the European guidelines 2018, the ABPM, that is ambulatory blood pressure monitoring, the diagnosis of the hypertension should not only be dependent on office BP measurement, but also on out of office. Out of office means either in the home blood pressure monitoring or 24-hour nighttime BP monitoring. Thus, this may be considered as the most relevant measurement for estimating the CV risk, because most of the patient has normal BP readings in the office, that is doctor's chamber, but they have high BP either in their home, either in their duty hours. So we have to look at the 24-hour BP control. If we do not control 24-hour BP coverage, then the European guidelines said that every increase in the 20 millimeter of Hg in the systolic or 10 millimeter of Hg in the diastolic BP increases the risk of the mortality by 23% and the cardiovascular event by 36%. So the 24-hour BP coverage is important, which can only be occurred only with the help of home blood pressure monitoring tool. Most patients with hypertension require lifelong medical therapy to achieve the optimal BP control. The 2018 European guidelines equally recommended 5 classes of antihypertensive drug. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve the adherence to the therapy. According to the new concept in the management of hypertension, previously we tell that the patient is suffering from the hypertension when the systolic blood pressure is more than 140 or the diastolic is more than 90. But according to the American new guidance, the patient is said to be hypertensive if their systolic blood pressure is more than 130 and diastolic more than 85. So 130 by 85 is now the recommended level of normotensive or hypertensive. If the BP is more than 130 by 85, then the patient is said to be hypertensive. And now we have to start with some maneuver in the form of lifestyle modification, or if the BP is not controlled, then we can go for pharmacological therapy. Thank you very much.